Good day everyone, I am delighted to present to you a comprehensive overview of sickle cell anemia. Sickle cell anemia is an inherited blood disorder that affects millions of people worldwide. In this presentation, we will discuss the definition, epidemiology, pathogenesis, clinical presentation, diagnosis, complications, treatment, differential diagnosis. Sickle cell anemia is an inherited blood disorder that affects the production of hemoglobin, which is responsible for carrying oxygen throughout the body. The condition is characterized by abnormal hemoglobin molecules, which cause red blood cells to take on a sickle shape, leading to a range of health complications. Sickle cell anemia is most commonly found in people of African descent, but it can also occur in people of Middle Eastern, Mediterranean, and Indian descent. It is estimated that 300,000 babies are born with sickle cell anemia each year, with approximately 100,000 of these cases occurring in Nigeria. The condition is also prevalent in parts of Africa, South and Central America, the Caribbean, and some areas of the Middle East. The pathogenesis of sickle cell anemia involves a mutation in the hemoglobin gene, which leads to the production of abnormal hemoglobin molecules. These abnormal hemoglobin molecules cause red blood cells to become sickle-shaped, which can lead to blockages in blood vessels, reduced blood flow, and tissue damage. The clinical presentation of sickle cell anemia varies from person to person, with some individuals experiencing mild symptoms, while others experience severe complications. The most common symptoms of sickle cell anemia include pain, fatigue, jaundice, and delayed growth and development. Complications of sickle cell anemia include acute pain crisis, stroke, lung disease, and vision problems. Diagnosis of sickle cell anemia typically involves a combination of physical exams, blood tests, and genetic testing. Blood tests can identify the presence of abnormal hemoglobin molecules and determine the percentage of sickle cells in the bloodstream. Genetic testing can confirm the presence of the hemoglobin gene mutation. Complications of sickle cell anemia can be life-threatening and include stroke, acute chest syndrome, anemia, priapism, leg ulcers, and organ damage. Individuals with sickle cell anemia are also at increased risk for infections, particularly those caused by bacteria that are normally found in the body. The treatment of sickle cell anemia involves a range of interventions aimed at managing symptoms, preventing complications, and improving quality of life. Treatment options include pain management, blood transfusions, hydroxyurea therapy, and bone marrow transplants. The differential diagnosis of sickle cell anemia includes other types of anemia, such as iron deficiency anemia and thalassemia. It is important to differentiate between these conditions as treatment approaches can differ significantly. In conclusion, sickle cell anemia is a complex and potentially life-threatening blood disorder that affects millions of people worldwide. Advances in treatment options have improved the quality of life for individuals with the condition. Early diagnosis and intervention are essential for preventing complications and improving outcomes. Thank you for your attention.